Good afternoon, everyone. Today I am Shikha Banerjee, Associate Professor of Brainware University from the Department of Pharmaceutical Technology. Want to deliver a topic that is anti-anginal drugs. So, anti-anginal drugs you will be knowing. Under this category, we will be studying about vasodilators, calcium channel blockers. So, from this drug, we will go for the amyl nitrate, nitroglycerin, pentothreol, thiotriol, tetranitrate, isosorbide dinitrate, and dipyridamole. And among calcium channel blockers, we will be studying verapamil, bipyridyl hydrochloride, diltiazem hydrochloride, nifedipine, amlodipine, felodipine, and nicardine and nimodipine. So after completion of the study, you will be learned to able to understand the chemistry of the drugs with respect to their pharmacological activity, understand the adverse effect and therapeutic value of the drugs, study the chemical synthesis of the selected drugs. So first of all, we should know what is angina pectoris. So that is the insufficient blood flow to the heart muscle from narrowing of coronary artery may cause angina. That is the chest pain. Suppose what are the coronary artery is present which is supplying blood to the heart, and as well as from the heart to different organs bloods are circulated. So if the bloods are circulated in a smooth pathway, there is no problem. But if there is cholesterol deposition or triglyceride deposition in the the artery will be narrowed. So as a result, oxygen will not be supplied properly. As a result, patient will be suffering chest pain. So this is the diagrammatic representation of the subendocardial crunch during an attack of the angina. See, for the normal in between the attack, you can see the 5 mm Hg diastolic pressure is there. But in case of during angina, we can see 25 mm Hg pressure is there here. So that is the ischemic subendocardial zone where during angina the pressure will be high. Now there are three types of angina, that is a stable angina, unstable angina and variant angina. So in case of stable angina, that is the most common type. It happens when the heart is working under the usual. Stable angina has a regular pattern, rest and medicine usually help. This is a normal angina, like that is no much problem is there. So medicine generally cure this problem. So next, coming to the unstable angina, that is the most dangerous. It does not flow a pattern and can happen without physical exertion. So it cannot show any symptoms also. It does not go away with the rest of the medicine. It is a sign that you could have a heart attack also. Okay. Next, variant angina. That is a rare and it happens when you are resting. Medicine can also help. So going for the picturization, see in the case of normal blood flow, where you can see there is no deposition of the cholesterol. For the stable angina, some of the cholesterol is deposited. Thus, as a result, heart pumping will be not in a rhythmic fashion. As a result, oxygen will not be supplied to the particular organ. In unstable angina, a thromboscleroside with blood clot has been occurred. So as a result, blood cannot be flow properly and a heart attack can be there. And coronary spasm, that is the variant angina, whereas the angina will be feeling so much spasmodic problem, continuous pain in your left side of the heart. So these are the different diagrammatic representation where the narrowing of vessel are going on. So classification of the drugs. So for the first category, you are studying nitrates. So among this nitrate, there are two types of drugs, short acting and long acting. In case of short acting, glycerol trinitrate, isosorbide dinitrate, that is a sublingual. You have to keep the drug in the sublingual position. For the long acting, isosorbide dinitrate oral, isosorbide mononitrate, erythritol tetranitrate, penta-erythritol tetranitrate drugs are there. Now coming to the beta blockers, that is important drugs. The beta receptors which are present in the cells of the artery, so that is blocked. As a result, the heart flow, the vasodilation occurs. So propranolol, metoprolol, atenolol, these are the very good drugs which are having the low high pressure, that is having the tendency to reduce the heart pressure also, high pressure also. Now coming to the calcium channel blockers, that is verapamil, diltiazem, amlodipine. These are the important drugs which is used for the high blood pressure also, and it is used in the angina also. Now next, coming to the potassium channel opener, that is a nicotine. Potassium helps in the heart contraction. So if there is any problem in the potassium, then the heart cannot contract properly. So where potassium channel is opened with this drug, and the heart can be pumped and the oxygenated blood can be circulated proper way. Next, other anti-anginal drugs, trimetazine, ranolazine, ivabradine and dipyridamole. These are the other anti-anginal drugs are also present. Now coming to the chemical classification, coming from the nitrates category, you can see that is the amyl nitrate, that is it is containing the NO3 or NO2. See first one, amyl nitrate. Amyl group is there and NO2. Next erythritol tetranitrate, where tetranitrate group is there. Okay. In case of pentaerythritol tetranitrate, whereas 5-membered carbon is there, pentaerythritol tetranitrate, tetranitro group is there, that's why nitrate is called. Next comes isosorbide dinitrate, that is used from a glucitol, gluconic acid to glucitol. Conversion is there where 2 nitro groups are there. Now beta adrenergic blockers drugs, that is containing 2 fused rings. Propranolol, that is all group will be there. Propranolol means propane group is there, CH2, 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 3 carbon groups are there, and amino group is there, and in the amino group there is a substitution of CH3 whole 2. Next coming to calcium channel blocker. So this is the general structure of the calcium channel blocker drug. See where 2 benzene rings and 1 nitrogen containing 6-member rings is there, where 2-membered COOR2 is there, and in case of R1, R2 and R3, if the R1, R2 and R3 are changed, then the drug name will also be changed, like amlodipine, phenodipine, nifedipine, nitrandipine and nimodipine and nisolodipine, where R1, R2 and R3 are changed, and X also. So this category of drug having different type of action. Next continued, that is one of the category of the calcium channel blocker, that is istradipine and benadipine. These are the higher category drugs, these are used seldom. Nicardipine, that is one of the most important drug and used in cases of high cases. Lacidipine also. Mendipine HCl, that is one of the category, not used so much. Now calcium channel blockers, another drugs, that is a conventional diphenyl alkylamine, that is 2 phenyl groups is there and alkyl group is there in between the ring, and amine group is there. See, in the amine group there is some substitution and cyano group is there. Verapamil, common name. Named diltiazem, that is one of the drug that is containing benzothiazepine ring. So thiazepine, here a 7-membered ring is there. 7-membered ring containing sulfur, nitro and oxygen. So benzothiazepine, this is a thiazepine ring that is attached to the benzene ring, OCOCH3, and some of the substitution CH2 whole 2 and CH3 whole 2. OCH3 orthomethylation has been occurred. Diltiazem, a very good drug for the angina. Bipyridine, another diaminopropanol, that is diamino group is there. In case of benzene ring there is a nitrogen, another in the substitute chain. Now some of the cardiovascular drugs are there which are used as digoxin and digitoxin, which are very important in case of cardiovascular contraction. Next cardiovascular glycoside continued, like the beta D glucose and beta D digitoxose, which is derived from the digitoxin. Delcelanoside, these are the drugs. Now among miscellaneous category there is dipyridamole and cyanidylate. Okay, so aspirin also, that is used in lesser cases when there is any excessive amount of cholesterol, that can be used aspirin, which can reduce the cholesterol also. Now these are the pharmacological modification of the major determinants myocardial O2 supply, that is not required for our medicinal chemistry. Now coming to the vasodilators, that is a mechanism of vasodilators, how it can act. Now use of nitrates in case of angina pectoris, acute coronary syndrome, myocardial infarction, CHF, that is a congestive heart failure, acute LVV, left ventricular failure, biliary colic, esophageal spasm, cyanides poisoning. So these cases the nitrates are used. Now there are some adverse effects like flush, fullness in head, that is loading of the head or heaviness, throbbing headache, flushing, weakness, sweating, palpitation, dizziness, fainting. Next, methemoglobin, that is hemoglobin is saturated with sulfur, Methyl group is there. So methyl group incorporation or sulfur group incorporation, as a result hemoglobin will be destroyed. Rashes are rare. Tolerance will be there. Some of the time, sometimes some of patient cannot tolerate the drug for a long time. Dependence, spasm of coronary and peripheral blood vessels. Myocardial infarction and sudden deaths can be occurred. Interaction. Sildenafil causes dangerous potentiation of the nitrate action. So this drug interacts with the sildenafil. So if sildenafil is taken with this drug, it can potentiate the nitrate's action also. Now coming to the first category of amyl nitrate, is a vaporol. It is a mixture of isomeric amyl nitrate, but it is primarily isoamyl nitrite. Iso group is there because at the second carbon, see at the second carbon one of the CH3 will be substituted. Okay, amyl because oxygen group is there. It is a mixture of isomeric amyl nitrate, but is principally isoamyl nitrite. It is mainly used in case of angina pectoris and also effective. It is used in the emergency management of cyanide poisoning by causing the oxidation of hemoglobin to compound methemoglobin. That means hemoglobin will be broken down if cyanide poisoning is there. So that will be, if it is converted to methemoglobin, then cyanide poisoning will not be occurring. Nitroglycerin. So if CH2OH, CHOH and CH2OH group is hydrogen is replaced with the NO2, it is produced 1,2,3 propane triol trinitrate. Well, glycerol trinitrate is the trinitrate ester of glycerol used in angina pectoris and extensively as an explosive in CH. And it is very important drug, congestive heart failure. Explosive क्यों बोल रहे हो? Because it can be used in the congestive heart failure also. Synthesis, ये वाला drug can be coming into the exam. So it is prepared from the propane 1,2,3 triol. See, it is a propane, whereas 1,2,3 position has been substituted the OH group. It is reacted with the HNO3 and H2SO4, where nitrogen group is incorporated in 50 to 60 degree temperature. Now penta-erythritol tetranitrate, that is 5 carbon is there. Erythritol tetranitrate. Erythritol is 4 carbon generally. So the name is 2,2-bis hydroxymethyl 1,3-propane diol tetranitrate. It is used in the treatment of angina pectoris. It relaxes the smooth muscle of small vessels in the coronary vascular tissue. Isosulfide dinitrate is one of the important, that is also known as the isoradiol orbitrate, whereas the IUPAC name is 1,4,3,6 dianhydro 2,5-diorthonitrodeglucitol. That means gluconic acid. It is effective in the treatment of acute angina attack. Very good drug. If any person having attack in your home, you can give a drug under the sublingual position, which will help to the occurrence of the death also. Synthesis. See, whereas D-glucose is there, we have seen the structure in the biochemistry also. So the hydrogenation D-gluconic acid is converted to alcohol. The aldehyde group is converted to alcohol. Then with the H2SO4, the ring closure is going on, and saturated 5-membered oxygen combining group is there. Then again for the nitration, NO2 group is incorporated. So from d-sorbital, see, from d-sorbital to glucitol. This is the name of the glucitol. Okay? Name of the product was, see, 1,4,3,6 dianhydride 2,5-diorthonitrodeglucitol. Now dipyridamole, that means 2 pyridine group is there. 2 pyridine group you can see, one of the pyridine group, another pyridine group. Where it is named as a 2,2-bis diethanol amino 4,8 dipyridine pyrimidine. Pyrimidine group is there. Here it is dipyridine. See, piperidine ring is there. 5-membered saturated ring, dipyridine. Piperidine ring is present. Dimenes 2, pyrimidine ring is there. 4,5-D pyrimidine. Right. Next, dipyrimidine is a drug inhibits the adenosine deaminase erythrocytes and interacts with the vasodilator. That means it is having a vasodilatory action. The action potentiates the effect of prostacyclin which acts as an inhibitor to platelet aggregation also. It actually potentiates the appearance of prostacyclin, which can initiate which is acts as an inhibitor of the platelet aggregation. That means whenever there is any blood clot, the platelet tries to clot there. So if it is inhibited, then the blood clotting will be not be there, and it will be broken down, and the blood flow will be normally supplied. It is a long-acting vasodilator. It has a long-acting action. Its vasodilating effect is selective for the coronary system. It is used to treat the angina pectoris. If some of the patient having continuous angina problem, it can be used. Coming to the calcium channel blockers, that is a CBC, whereas phenylalkylamine benzothiazepine and dihydropyridine is the classification. For the phenylalkylamine, verapamil is the structural known, benzothiazepine diltiazem, and dihydropyridine first generation, second generation, third generation drug is there. For first generation nifedipine, it was used in the previous cases, but due to some toxicity, second generation isradipine, nicardipine and felodipine is used. There were some problems in the nicardipine also. Next, coming to the amlodipine, this is also having some problem like the swelling of the legs. These are the different type of calcium channel blockers which we do not need to study. There is a mechanism of action. Whenever the calcium is going to the heart and it can contract, so there will be problem to the circulate the blood. So calcium channel should be blocked so that angina pectoris will be solved. So this is the drug of the verapamil, a long structural drug, but is having two benzene rings just attached with the fast and in position, where is amino methyl amino group is there, amino 2 propyl pentanitrile. See the pentanitrile group, pentanitrile Cl, penta means 1 2 3 4 5 group is present. Okay, it is used in the treatment of angina pectoris, arrhythmias from ischemic myocardial syndrome, that is arrhythmia, rhythmic problem of the heart, supraventricular arrhythmia, ventricular problem. Now there are some adverse effects like nausea, constipation, bradycardia, flashing, headache, hypotension, tachycardia. Like these are the different problems solved with the verapamil, because every drug having adverse effects. Now interaction with verapamil is there, that is not required. Now bipyridine, one of the drug, diltiazem, some of the adverse effects of diltiazem is there, you should study well. Now nifedipine, that is one of the important drug. See the structure, 3,5-dimethyl to 6-dimethyl 4-nitrophenyl. Here the nitrophenyl ring is there. 1,4-dihydropyridine. See, it is a 1,4. 1, 2, 3, 4 dihydro. Hydrogenation is there. 3,5-dicarboxylate. It is used in the treatment of vasospastic angina and hypertension. Now there are some adverse effects of nifedipine also. That's why we are going for the third generation amlodipine, that is sold under the brand name of Amlodac, Stemlo, Amlong. This is another category where the CH3 group is there. Basically you can see the rings where a pyridine is there, nitrogen containing 6-membered is ring there, and it is following in the amlodipine also, but there are some substitutional changes. See where you can change. For the nifedipine, one nitro containing group, nitrobenzene group is there. For amlodipine, a chloro group, chlorine containing group is there. And there may be some substitution in case of hair and in case of hair. Okay. So nifedipine is also used as antianginal and antihypertensive agent. Some patient you have been find some of patient with high pressure continuously taking the amlodipine. Felodipine not used so much. Nicardipine, that is used in the treatment of angina and essential hypertension. If some of the person is having severe hypertension, then they are used, but not always, and essentially it is given. Nimodipine, another drug. So thank you everyone for this listening, and follow this chapter, follow this video. Thank you.